Hi, Dr. Tsay at Ageless MD. One of the things that happens as we age is we actually lose the fat in our face. We lose fat volume. And a lot of people think that, oh, if I can just get a facelift, that just would be the solution. And that's actually incorrect. When you lose the fat in our face, of course it causes everything to sag. And many people, all they need to do is to replace the fat in their face. Now, of course, we can use the fillers out there like Juvederm or Restylane or Sculptra to rejuvenate the face and the skin. But wouldn't it be nice to use your own body's fat? That's the most natural filler there is in the world. So we're gonna be doing a case of a fat transfer. We're taking fat from someone's abdomen and putting it into their face, replacing the lost volume, the lost fat that has happened over the decades of life. In addition, we're gonna be processing the fat down to nanoparticle size. And that's, for the math geeks out there, 10 to the negative 9th power. That's smaller than a micron of particle. And by doing that, we're actually getting the stem cells, the regenerative cells from our body, which is found abundantly in fat. And we're using that on a more superficial level, injecting it into the subdermis of the skin to rejuvenate collagen, to stimulate collagen growth, and basically to wind back the clock on your face. Now this process or procedure takes a couple of hours and is done in office. There's no general anesthesia. The patient's gonna be nice and relaxed using our Pronox device, which is laughing gas or nitrous oxide. And everything's done with local anesthesia. And we're basically using tumescent solution, numbing the lower abdomen, taking the fat from the lower abdomen, and then processing it and then injecting it to her face. So what are some commonly asked questions that people may have about this procedure? Number one, does it hurt? Well, the patient's gonna be relaxed with our Pronox device, which is laughing gas. We're gonna be using tumescent solution, which is local anesthesia, into the lower abdomen, and which requires no anesthesia, general anesthesia. How long does the fat transfer last? Basically, how long of a result can you expect from fat transfer? Well, the fat transfer is not completely permanent. It can last from 3 to 5 years and beyond, but it can atrophy. Like if you were to lose weight, some of the fat may reduce. Vice versa, if you were to gain weight, some of the fat may increase in size. So prior to undergoing this procedure, you want to make sure that you're at a very stable point in your weight and that you won't be fluctuating too much up or down. How long is the downtime? Typically, you want to have at least 1 to 2 weeks socially acceptable downtime where you're going to be a little swollen and possibly most likely bruised. And after about 2 weeks, you definitely can return back to work and have full function, as well as using possibly any cover-up makeup to cover any residual bruising that may still persist. How long does this procedure take? It takes approximately 1 to 2 hours from beginning to end. Who is a good candidate and who is not a good candidate? Well, in order to be a good candidate, you need to have a sufficient amount of fat in your lower abdomen. If you only have 7% body fat, you're probably not a good candidate, and you're probably better off getting other types of fillers that are on the market like Juvederm or Restylane or Sculptra and giving volume that way. Again, if you do have sufficient fat, then actually the fat is one of the most natural filler substances there is, and it's all natural because it's your own body's substance, your own body's fat.